Sleep health. It's more important than you think. My name is Erin King, and I'm a nursing student at Indiana State University. This presentation is geared towards the population at risk of adults in the United States, primarily with chronic conditions that are affected by sleep health. I ask at this time that you please take the pretest and pause the video. Sleep recommendations. 1/3 of adults in the United States report that they typically get less than the recommended amount of sleep. According to the ODPHP, 25% of adults in the United States report getting less than the recommended amount of sleep at least 15 days out of each month. Adults need at least 7 hours of sleep per night for optimal health and well-being. Sleep is necessary. Adequate sleep is necessary to fight off infections, support the metabolism of sugar to prevent diabetes, and to perform well in school and safely and effectively in work environments. Sleep timing and duration affect multiple body functions that are critical to individual health maintenance. If left untreated, sleep disorders and chronic short sleep are associated with an increased risk of heart disease, high blood pressure, obesity, diabetes, and mortality. Health effects of lack of sleep. Sleep has an impact on one's health and well-being, just like nutrition and physical activity. It is a basic need for child growth and development, as well as adult health. Loss of sleep and untreated sleep disorders can affect behavior, reduce productivity, and increase the chance for errors or accidents. Sleep health is a particular concern for individuals with chronic disabilities and among older adults. Untreated sleep disorders can decrease health-related quality of life and may contribute to a functional decline. Sleep and chronic illnesses. Studies have shown that there is a correlation between lack of sleep and an increased risk of developing type 2 diabetes. According to the CDC, hypertension, stroke, coronary heart disease, and irregular heartbeats have been found to be more common among those with disordered sleep than those meeting recommended healthy sleep requirements. Studies have shown that short sleep duration, less than 7 hours of sleep per night, can result in metabolic changes that can be linked to obesity. Persons with depression can have sleep disturbances, but sleep disturbances and disorders may also cause depression. Studies show that insufficient sleep duration, as well as insufficient physical activity in children, are associated with mental health disorders. Common sleep disorders. Insomnia. Insomnia is a sleep disorder characterized by an inability to initiate or maintain sleep. Narcolepsy. The hallmark signs of narcolepsy are daytime sleepiness, including episodes of irresistible sleepiness, combined with a sudden muscle weakness. Restless leg syndrome, or RLS, is characterized by a creeping or jumpy sensation and often feels like it originates in the lower legs, and often is associated with aches and pains in the legs. Sleep apnea. Snoring may be a sign of sleep apnea. Persons with sleep apnea can make periodic gasping or snorting sounds during when their sleep is briefly interrupted. Those with sleep apnea may also experience excessive daytime sleepiness. Good sleep hygiene. Some habits that can improve your sleep health. Be consistent. Go to bed at the same time each night and get up at the same time each morning, including on the weekends. Make sure your bedroom is quiet, dark, relaxing, and at a comfortable temperature. Remove all electronic devices such as TVs, computers, and smartphones from the bedroom. Avoid large meals, caffeine, and alcohol before bedtime. Get some exercise. Being physically active during the day can help you fall asleep more easily at nighttime. What if I can't sleep? What if I've practiced all of the good sleep hygiene tips provided and I still can't sleep? If your sleep problems continue and interfere with your daily level of functioning, you should talk to your healthcare provider. Before visiting your healthcare provider, you should keep a diary of your sleep habits for about 7 to 10 days to discuss at the visit. Inside your sleep diary, you should include when you go to bed, when you go to sleep, when you wake up, when you get out of bed, when you take naps, when you exercise, when you drink alcohol, and when you drink caffeinated beverages. Bring this diary to your visit with your healthcare provider. On this page, I've provided links for online resources regarding sleep education, sleep disorders, and additional information that you may be looking for regarding sleep hygiene. I hope you found this presentation on sleep hygiene and sleep health informative. Please take the post test and see what you've learned today. Thank you.